Exactly. And that's why we've added accreditation into it, because it has all the same tenets. The people doing the work are the ones that know it the best and can identify problems, fix the problems, instead of having the managers come in and put in the incorrect solutions.
Hi, everyone. I'm Tracy O'Rourke.
And I'm Elizabeth Swan.
And we are from GoLeanSixSigma.com, and you're listening to the Just in Time Cafe podcast, where we wrestle with tough questions, talk to thought leaders, discuss great books with authors, and get insights from Lean Six Sigma practitioners.
We let you in on helpful apps, we bring you the news, and challenge the status quo so you can build your problem-solving muscles.
Elizabeth, what's on the menu today? Anything good?
Yes, we have an excellent lineup. Today's special is my interview with the head of Lean Cultural Transformation for Exeter Health Systems, Mary Beth Germain, a fabulous leader we met on the Japan study trip. She's got some great insights around meeting certification requirements in a lean way in a healthcare system. We've got the results of our latest survey where we'll find out where people stand on the different phases of DMAIC. And the improved phase did not win, Tracy.
What? We really thought that was going to win.
Totally. For our In the News segment, we're going on the road and we're going to let you in on where we're headed so you can meet up with us. And for Q&A, we'll answer a learner's question about, does lean mean doctors spend less time with patients? It's a great day at the Cafe, Tracy.
Yes, it is. Remember to stay tuned for this month's coupon code in order to get a discount on GoLeanSixSigma.com's online training.
Let's get to the poll.
So I thought the improved phase was going to win this one, Elizabeth.
Totally. We both did. So this was a surprise. So this month's question was, what is your favorite Lean Six Sigma phase? So no surprise, control, which is building the structures to hold on to the gains of your improvement, came in dead last, under 10%. So no excitement in control. It's like housekeeping or maintenance. It's just not a big vote getter, although quite necessary. And then the define phase, which is where you determine which problem to solve, did marginally better at 12%. So people just want to start solving the problem. So, so that that's why we understand why this one gets no love either. And then the measure phase, where you collect process data about your problem, did a little better at 14%. And yes, we both thought the improve phase, where teams solve the problem, would be the top vote getter, but it's at 30%. So it got more than double the votes of the measure phase. So people are twice as excited about improve than they are about measure. But the big winner, with over a third of the votes, is the analyze phase. So determining the root cause of a problem is the favorite for almost 35% of the survey population. And Tracy, did you expect analyze to come in this high?
No, I did not. But, like we talked about, everyone loves to be an improve. That's where all the glory is. And it feels good to be an improve, but I'm actually really happy that Analyze won. I feel like we're talking about Oscar winners or something. Analyze was the big winner because we really do need more root cause analysis in this world. Organizations need it. I think organizations are still jumping to solution all the time. We get a lot of head nods when we talk about that in any training class. We say, how many of you guys feel like we jump to solution? Everyone's like, yep, we jump to solution too much as organizations, as problem solvers. And Analyze really is having people pause with finding root cause before you jump to a solution. So I'm happy to hear Analyze won.
Yeah, you're actually just reminded me, I was running a workshop earlier this week, and one of the participants said that not only are people told as soon as there's a problem, leadership says, bring me the solution, they actually want it the same day. Like they'll find a problem and they'll say, please, tell me how you're going to solve it by, 10 a.m. So she's like, it's really a problem jumping to solution. So this is, as you say, great news. It's the meat of DMAIC. One thing about PDCA is that they bundle, define, measure, and analyze into plan, the P of the phase. But, as this poll is reflecting, analyzing the process and the data to get to root cause is critical, right? As you say, without it, it doesn't matter how much defining and measuring you do. And if your improvements are a crapshoot, because like you said, you didn't get to root cause, without good analysis, there's no lasting improvement. So thanks everybody for participating in this month's poll. You can check out a Pareto chart of the findings on our website under the podcast link. And Tracy, why don't you tell everybody what the next survey is about?
Sure. For our next poll, we want to know, what is your experience with rapid improvement events, otherwise known as Kaizen events? So here are your options. I have heard of rapid improvement events, but they are not on my radar. I wish I knew more about rapid improvement events or Kaizens. They sound useful. I have been involved in rapid improvement events or Kaizen events, and I would like to run them myself. I conduct rapid improvement events all the time. They're part of how we operate. And lastly, Kaizen is just the way we think. It's not an event. There's always a better way. So weigh in, let us know your preferences. We'll discuss the results with you next month.
I'm Elizabeth Swan, and you're listening to the Just in Time Cafe podcast. We love your feedback. Please leave us a review on iTunes, on our website, and don't forget to subscribe.
All right, up next, it's in the news.
We're going on the road, Tracy.
Yes, we are. We want to take some time to tell you about a lot of things we're doing with other organizations. One thing we definitely do is we go to conferences. It's great to see our colleagues. We get to learn new techniques and see what's happening in the continuous improvement community, and we definitely get inspired. Also, maybe you can meet up with us at one of these. Elizabeth, you can start by describing the PEX conference happening next month.
Yes, we'll be at the Operational Excellence Business Transformation Leaders Summit. That's a mouthful. That's put on by IPQC. It's taking place August 26th to the 29th in San Diego, Tracy's home. So that's very soon. And one of the draws for us is this Women in Leadership panel that's happening on Thursday the 29th. And many of you are aware of our Wonder Women in Quality series. And a lot of the women we highlighted participated in this panel in the past. So this is a great opportunity to meet other women making a difference in this field. And I'm really excited about that.
I am too. And I'm really looking forward to participating in the Women in Leadership panel as an attendee. But, I think what's really interesting that we should share with our audience, Elizabeth, is one of the really interesting things about the Wonder Women of Quality series that we do is a lot of times when we would ask women that we thought we would love to highlight them as part of our Wonder Women of Quality series, we got a lot of people saying they turned us down. And ultimately, when we asked them why, they felt like they hadn't done enough. And I think that was a little shocking for us, right, to find out. And I went to lunch with Sally Toyster, and we were talking about how women aren't big on self-promotion sometimes, and if that has an impact on our reach. I think that would be a great topic for our Women's Network is, how do we feel about self-promotion? Do we avoid it? How do we get more comfortable with it? Maybe, I don't know, what do you think? I could be wrong.
No, you're right, because there's no guy that would have said no. There's like, even if I called it Wonder Woman Equality and I said, you got to sign up for that, they'd be like, okay, fine, I'll be a woman then.
Yeah, it's really interesting, just the different dynamic, because you're right. I mean, we've asked a lot of men to do podcast interviews. We've never been told, no, I don't really feel like I have a lot to add. So I thought that was very, very interesting. And
it was. And yeah. Some of them were gracious and said, I can nominate somebody else for you. And I'm like, okay, but you're a hot shit too. You should be one of these. That was... Yeah, no, that was a shock to me, and I'm psyched to go to this and talk about this issue at the panel. That would be great. So Tracy,
yes, it would.
Tell everybody about the other conference we're going to, AME.
Yes, so we are going to the Association for Manufacturing Excellence Conference, otherwise known as, you said, AME. We have a lot of GoLeanSixSigma.com staff members in Chicago, so we get a chance to meet up with our own people since we have a lot of virtual employees. I went to this conference last year in San Diego. I thought it was one of the best conferences I've been to. The speakers that they select, the keynote speakers, blew me away last year. And I see that the lineup this year is looking pretty good. We've got Richard Sheridan, author of The Chief Joy Officer. He's keynoting along with Tom Peters and many others. So if you really get inspired, you want to be inspired, I would say get your butt to Chicago in November.
Get your butt to Chicago, exactly. And come hang with us. Another organization we love to partner with is Lean Frontiers. They've got their Lean Coaching Summit, Leader Summit happening July 1st to August 30th, which is coming right up. I went to that last year and I met a lot of great folks like Karen Martin, who wrote Clarity First, Karen Ross, who wrote The Toyota Way to Service Excellence, and Mohammed Saleh, Lean Transformation Leader at Hartford Healthcare, all guests of this podcast. And if you miss that, Tracy and I are both taking part in their summer webinar series. Mine is going live Tuesday, July 30th at 2:30 Eastern. It's called 3 Improv Secrets That Will Up Your Problem-Solving Game. I performed with Improv Boston for years back in the 90s, but I use improv all the time. It's basically problem solving on stage. It's a fun session, but it's truly super practical. So we'll provide you a link to that.
That will be really exciting.
Well, thank you, Tracy. You can reach out to Tracy and I on LinkedIn. Let us know if you're attending any of these conferences or if you're going to join us on a webinar. We'd love to meet up with our community.
And here's one last bit of fun news. For the 4th year in a row, GoLean6Sigma.com has been recognized as one of Hawaii's fastest growing small businesses. This came out in the Pacific Business News as part of the 25th annual Hawaii's Fastest 50. We'll find out our ranking on August 8th. The year I went, we were ranked number 6 out of 50. 6 of the 6th fastest growing company in Hawaii, because we are based in Hawaii. So we're shooting for some high numbers. Stay tuned.
Stay tuned.
I'm Tracy O'Rourke, and you're listening to the Just in Time Cafe podcast. And in a short while, we get to hear Elizabeth's interview with Mary Beth Germain, the leader of Lean Cultural Transformation across Exeter Health Resources in New Hampshire. Next up, it's a question.
Nice accent, Tracy.
Thank you. I am from the East Coast originally. Next up, it's a question from one of our listeners. This question is pitting efficiency versus effectiveness.
Yeah, the question we're addressing today came from our forum, and it's addressing the idea of efficiency. And the question was, if doctors were to move faster, wouldn't they be spending less time with patients? And what this brings home for me is that they fear what they lose when they try to improve flow or make a flow more efficient. But the idea is for doctors to spend less time doing non-patient tasks. Right, Tracy?
Exactly. So the value add piece for a doctor's visit is that the doctor gets to spend time with you. So the goal is not to eliminate the value add, but to eliminate the non-value add out of the processes. So it's the stuff that pulls doctors away from patient time. So filling an order, filling out paperwork, completing a file, all of these things they probably have to do at the end after they're done with a patient. And that takes away from the time that they can spend with the patient because they've got their next appointment coming up. So the whole idea is, and I think it's a good question, because I think if people feel like we're making the doctor's process more efficient, that means that there's less time with the patient. But that's not the idea. The idea is reduce the non-value add stuff, the stuff that the patient doesn't care about as much, so that you can spend more time with the patient. That's really important.
Yeah. Sometimes when I try to describe process improvement to someone who's new to the concept, which, by the way, is a real buzzkill if you try to do it at a party. Sometimes they say, they'll cut to the chase and they'll say, it's about efficiency, right? And that always makes me pause, because what you're really trying to do is find the best way to achieve your outcomes. So in healthcare, as you're saying, it's about patient wellness. And if we spend less time dealing with paperwork or waiting for labs or searching for equipment, then we have more time to help the patients, on their path to getting well. So you're always solving problems for a reason. And the idea is to focus on the desired outcome. Doctors aren't just moving faster, they're getting to the patient sooner. We sometimes forget what the ultimate outcomes are for improvement efforts. The goal might be cycle time reduction, error reduction, but why are we addressing that metric? I just did some observation of a hotel process, and one project is to reduce the time to clean a guest room. They were looking at making the carts more visual and easy to use, maybe adding some stitching so you could immediately visually tell a queen sheet from a king sheet. But the outcome was that when a guest checked in, even if it was before standard check-in times, that they could be welcomed into their room. You know, it was all about a wonderful guest experience. So it's a great habit to put the outcome in front and center, so you always remember why you're trying to be more efficient.
Yeah, I really like that. And talk about a buzzkill. So my dad never knew what I did, and he would just tell people I was an efficiency expert, and it would make me cringe.
Yeah.
But because what does that mean? That I eliminate heads? No. So it's really thinking about what the outcomes are is really important.
At least your dad was trying to figure out what you were doing and trying to put a name to it. At my 40th birthday party, my friend sang a song called "What the F Does Elizabeth Do?" Talk about no idea. Okay, it's time to announce the coupon code.
This code is for 20% off any of our Lean Six Sigma training and certification courses: white belt, yellow belt, green belt, black belt, and lean training.
If you've just joined us at the Just in Time Cafe, use coupon 20ENGLISH. That's 20ENGLISH during checkout. Make sure to use it soon, since the coupon code will expire on the 15th of August.
Coming up next is today's special. Elizabeth, give us a little preview of your interview with Mary Beth Germain.
Mary Beth was on the Japan study trip, and I got to spend some good time talking with her. And we found out we actually met in former jobs, lives back at Kodak. So we talk about kind of how we met years ago doing process improvement in another venue. But she is dealing with requirements in the healthcare world around kind of almost like ISO certification, which can really bog down in minutia and detail and become an incredible drain on productivity in itself. But she did an amazing twist on how they addressed it, and it actually flipped and did the opposite. It became a lean piece, which was really cool what she did with it. So we'll talk about that. And I say tune in. She is lovely to listen to.
Very nice. I can't wait to hear, because I got to meet her as well, and she's very insightful. So looking forward to hearing what she has to say.
Welcome to today's special. My guest is Mary Beth Germain. She is the leader of a lean cultural transformation across Exeter Health Resources near me up in New Hampshire. And they are a system including a community hospital, a physician group, visiting nurse association, and hospice. Welcome, Mary Beth.
Thank you, Elizabeth.
Absolutely. Mary Beth has been applying Lean Six Sigma and Lean principles to organizational operations within multiple industries for the past 25 years. She's initially honed her skills at Eastman Kodak Company, where she was lucky enough to get in-depth Lean training from former Toyota senseis from Japan, which is awesome. Since then, she has led global enterprise-wide Lean and Six Sigma for efforts for Fortune 500 companies and consulted with several hospitals and imaging and orthopedic centers. Currently, she's responsible for leading this lean cultural transformation across Exeter Health Resources. Mary Beth holds a BS in Industrial and Manufacturing Engineering, which are great things to have. She also has an MS in Statistics, which I'm thoroughly impressed with. She's a Master Black Belt, a Certified ASQ Quality Engineer, a Certified Manager of Quality and Operational Excellence. You have an incredible credits there, which is kind of our topic of our discussion. But and she's a strong believer in changing process to change culture, and her passion is to develop others to see things differently. And I got to meet Mary Beth recently on our trip to Japan. We were both on a Japan study trip run by Katie Anderson of KBJA Consulting. And I think it was during our first dinner in Nagoya that we figured out we probably crossed paths at Kodak ages ago, right?
We did, as well as with another participant of the trip.
And you have both gotten into healthcare, which is fantastic. So you both honed your Lean Six Sigma skills early, and you have come through many industries to land in healthcare, which I'm particularly excited about because I feel like it's an industry, well, I know it's an industry that affects all of our lives, and we're not doing great. So we have to do better, and this is the opportunity. So I'm excited that you're in it, and I want to know, you in particular, you're dealing, I think in healthcare, it's coming back to all the achievements you've got in this quality world. The healthcare industry really does care about your accreditation. So how are you dealing with lean accreditation in the healthcare world?
Yeah, that's a great question. And I think we're unique in the sense that we are integrating lean and quality. Usually they're competing priorities in many industries as well as in healthcare. And we are integrating those concepts. And we've been spending a significant amount of time revamping our accreditation process. And I don't know how familiar you are with, we have Magnet as a nursing excellence program here. We have DNV, or we were once a Joint Commission hospital, and now we're DNV. And
what's DNV for our listeners?
DNV is an accrediting agency, and they do, they accredit different industries around ISO 9000 and different other regulatory requirements.
Gotcha.
So it's DNV moved into healthcare, I want to say 8 years ago or so. They were doing ISO certification and compliance for manufacturing. I think they started in the nuclear industry initially for accrediting nuclear industries. And now they are doing healthcare. And as we transitioned over from Joint Commission to DNV, they required ISO 9000, which is a quality management system.
So that's specific, very, very specific in terms of they're requiring Exeter Health Resources to become accredited. Is that fair enough? I mean, not everyone who does lean transformation has to be accredited, right?
Exactly. So in order to become Medicare and Medicaid providers, you have to follow regulations and guidelines set forth by CMS. So that's the Center for Medicare and Medicaid Services. And what we do, you can get accredited by the state that does CMS. And from a state perspective, or you can have an outside agency accredit you. Many healthcare agencies have Joint Commission do that, and we did that as well, and then switched over to DNV as an accrediting agency. And because, as I mentioned before, when you move over to DNV, you are required to be ISO 9000 compliant, which says that you have to have a quality management system in place. So in industry and in manufacturing, that's very common. In healthcare, that's not very common.
No, I've not. Yeah, definitely I've not run into that. And that sounds like a hurdle. I mean, that sounds difficult, right?
It is difficult in the sense that it's very new to the healthcare industry. Setting up quality management systems. So healthcare a lot of times has the competing priorities around value-based purchasing. You have accreditation. You have several different accreditation agencies that come in. In our case, we're Magnet designated. So there's regulations and guidelines from Magnet. So every time we added a different accreditation, I'll say, or designation, it required developing more structures in place to support that. And we stepped back and looked at that and said, wait a minute, this is ridiculous. They all are requiring, we're letting our regulatory requirements drive our goals and structures and design of the organization. And we stepped back to take a look at that and said, all of these initiatives have the same end goal in mind, which is safety, quality, and patient experience. How can we step back and look at that and start integrating existing structures and integrating our structures and our processes so that it's not a structure and process for every different initiative?
So it sounds like it was overwrought, overdone.
Exactly. So it like I said, it's all the same goal. Each of them want safety, quality, and a good patient experience. But we were duplicating efforts. We were killing our staff and our directors because every time they turned around, there was another priority or initiative that they had to take and integrate into their organization. And operationally, they couldn't handle it anymore.
Yeah, I mean, at a certain point, it's going to cut into patient care, right? You're taking people away.
Yeah, for sure. We would have, we'd have several different audits to ensure compliance. We would have different teams. So magnet designation, we had several magnet teams. We have ISO, so we had several based on every chapter of the NIHO standard, the CMS standards. We had process owners, so we had teams for all of that. We had quality improvement teams because we have a quality group. We had lean, so now we have lean improvement initiatives, and it was just too much where people were screaming uncle.
So you came back to, which is great, clarity around what's the goal, what's the end game here, what are we all about, and those pieces are very clear to you. So once you did that, you scaled it back.
We did, and actually we treated it just like an improvement project and followed it through the improvement process. So we developed a problem statement. We put together a Kaizen team. We ran a Kaizen event with all of the different owners of these different initiatives, global initiatives, to lay out we assessed current state, identified that we had the critical many, and we couldn't do it. We were working on everything and getting nothing accomplished. And they were very siloed activities. And finally, as I mentioned, the managers were saying, we can't do all of this. And we looked at it from the manager perspective, as well as the patient, but we're really looking at our manager director perspective.
So that's kind of a cool, meta project, right? So you're using lean, you're using Kaizens to come back. And Kaizen, for those of you unfamiliar with the word, it means it's a rapid improvement event. Like you're getting together for a few days with this particular group and based on, like you said, a particular problem statement. So you're using that to address, being asked to officially be good at doing lean and quality work. So were there some upsides? Was there positives to even just running that Kaizen you just described?
There were, because as I mentioned, there were so many competing priorities that the owners of each of the priorities didn't understand the requirements of each other's initiatives. So stepping back and understanding all of the requirements, and it was significant overlap of the requirements. And it gave everyone a different appreciation for what needed to be done and why. So we were stepping in each other's shoes to see their different viewpoints. So I think there was, from a team perspective, it was significant team building with leaders that could be adversarial because they were competing for the same resources.
So I wonder if part of that was learning more about what each other did. I mean, not just this initiative to get accreditation, but actually boots on the ground. What do you do every day?
Exactly. And why? Because there's support organizations asking operations to do work. And operations were getting frustrated because they said, they keep asking us to do this work. They don't understand our work. And going back and forth in that respect. So for sure, it was understanding why. And then the support areas that were running some of these initiatives understood what the requirements and the requests that were coming from, that were being asked of operations.
Yeah, so helpful to understand why people are doing things and then what actually all of our parts are in this. So what was the upshot? Did people sort of back off, or did you, once you saw the overlaps, did you say, okay, you guys are handling this, no need to do that, or we'll handle this part of it?
Yeah, so what we did is during the Kaizen event, once we identified the requirements of each program, we identified all the similar requirements, so all the redundancies, and then looked at the pain points around the processes that were being asked of the different people in the organization. And then we created, based on that, an integrated improvement structure. We call it our quality management system, our business management system. We have a couple different names. We haven't really totally named it yet, but it's an integrated structure that all improvement follows. And it stems with our HOSHN, or our strategy deployment, at the top of the structure that drive the initiatives.
And everyone buys into it.
They do buy into it. The one thing with accreditation or with healthcare is you have to, these are regulations, so you have to do it. But what's the best way to do it so that we're not having the regulations drive our process, we're having our process improvement drive the way we do our work in order to meet our regulatory requirements, and it becomes the way we do our work and not an add-on to our work.
That's such a great point. And I think that government workers also struggle with this because they're dealing with just a host of regulations, which I'm sure, and they just keep getting added, right? With good intentions, we're looking for safety, we're looking for accountability, right. But you're describing such a recurring problem, which is then the regulations start to run your operations, like how you do things. And you make a great point. Like that's the opposite of what you want.
Exactly. And with the other piece of this is Joint Commission would do a survey or an audit every 3 years. When we went to DNV does an audit every year, a survey. They call them surveys every year. So they come in and go from top to bottom of our organization and interview all the staff, not all the staff, but they interview staff to understand how we are following our regulations, how we're following the standards, and what are our process improvements. So they're looking for improvement as well. And their managers and directors, they're asking staff.
What do you think of that?
I think it's great. And that was the other thing, is accreditation used to be in the hands of the quality group. They owned all of accreditation, and I feel like a lot of us study for the test. So just before we know an audit's coming, we get prepared. And our goal was to always be ready, regardless of when anyone walked in the door, that we would be ready for an audit, and it wasn't an event anymore. It was just the way we did our work.
That's such a great phrase. You guys were studying for the test.
Yeah.
And now, it's work. People have to get interviewed. There's probably tension around it, like any audit. The word audit, I think, strikes fear into the hearts of many. But now it's really about making sure you're doing right by your patients. You're doing right by your people. And that's a good goal.
Exactly. And the staff now are excited to show off the work they're doing. We've identified different process owners for the different standards, chapters of the standards. So the operations own the standards, not quality or, an accreditation team. All of the different process owners own it to implement processes that follow the regulation, that follow the standards.
And that's kind of the nirvana of lean transformation, right?
Exactly. And that's why we integrated lean into our lean and quality management system. We've added accreditation into it because it has all the same tenets. The people doing the work are the ones that know it the best and can identify problems, fix the problems, instead of having the managers come in and put in the incorrect solutions.
That's such a great shift. And how interesting that something that was just overblown bureaucracy ended up, your approach to it ended up pulling it in as a way to build your problem solving culture. Like that's kind of a really cool flip.
Exactly. And where we used to have all of these meetings, we had existing, I'll say, lean structure in place. So we have tiered huddle system in place from the front line all the way to senior management. So instead of having all of these extra meetings, any issues that came up in operations would get brought to huddle, and then it would get assigned to a unit-based council or an improvement team to work on that improvement at the unit level. We also have internal audit program, which is needed, required as part of the accreditation. And so the internal audit program is developed to go out to the areas based on risk. Instead of going to every area and auditing, we do it based on risk.
Really good, really targeted. You're not wasting anyone's time. You're responding, it sounds like, immediately to issues. It goes right from your huddle into, okay, what do we do?
Exactly. And you know it's successful when an area will call and say, hey, can you have the internal audit team come here? We're not so sure. We feel like we have some vulnerabilities. And they come in and ask our team to come in and audit, which is totally different than it was in the past.
Yeah, nobody requests an audit.
No kidding.
How wonderful. That's incredible. And I do want to ask, just because we were just in Japan, and it may not even relate to what we're talking about, but I'm just curious, is there any one thing that you brought back with you from all that you saw? And I know we saw healthcare, we saw manufacturing, we saw schools. But I found that even though it wasn't all healthcare examples, you could pull from everywhere. But is there something you sort of pulled from our experience that you immediately have been trying to work into your own culture?
Yeah, the one thing is we have a safety temperature that we call it a patient safety temperature right now in our huddles. So if people, if they feel there's a risk, either high risk patients, different things that they could be a risk to a patient or patient care, they rate the risk in our huddle. So it goes anywhere from red, yellow, orange, yellow, green, green being no risk, red being major risk, that we feel is a major risk. So we were doing it from a patient perspective, but we did see in Japan where they did it from a staff and employee perspective. How are they feeling today? And why are they feeling that way? Do you recall that, Elizabeth?
That was fascinating. And I think it had to do with the fact that they were starting to bring more workers from outside of Japan. And he was working very hard to understand, like there's different languages, things like that. So I think that was, I don't know if that was Magora or not, but that was trying to understand it, what was happening with those employees.
Yeah. So I've been trying to do that with the lean group. We've been doing we call it, how are we feeling today? And we usually do red, yellow, green. And based on that, we'll ask why, and is there anything we can do to help with that? So I know they got more specific, but we're just introducing how are we feeling.
That was a big learning too, like you're saying, that to ask why. So not just, hey, red, green, yellow, and different. It's like, well, okay, red, then what's going on? Because we saw the comments there that someone said they didn't get a great night of sleep.
Yeah.
Or their kid was sick, or they were starting to feel sick. So that's important. And it's not just important when you're operating heavy machinery, it's important when you're working with patients.
Yeah, exactly. And, as we started rolling this out to different groups now, and when one of the directors said to me, well, I feel that when I ask why, I feel like I'm being, and so I said,
like
well,
intrusive.
Yeah, intrusive. And I had mentioned to her, well, they're being open and saying they're red, so they may want to talk about it. And so at first they wouldn't ask in public, they would do it offline. But then as the team got more and more comfortable, they asked in the group, in the huddle, and people were very open to explain why they were red, and that's helped the team dynamics significantly.
That's a great story. I love that, because especially that moment there where, asking why, isn't that intrusive? And we are kind of trained not to ask why in dealing with people and why they do what they do. But it's like you said, they said it's not good. So there's an opening there. And to not ask is actually ignoring an opening. And
exactly.
And all you could do is try. Like you said, let's try. And if it didn't work out and it turned out to be people feeling that was intrusive, then you could have shifted course. But the opposite was true.
And we're very, I think something we're doing better now too is when we we pilot these tests of change, we're very clear to say, hey, this is a pilot. It may work. We might fall flat on our face with this pilot, but it's only a test. It's not something we're going to do forever. If it doesn't work, we'll do something different. We just need you to be open and honest with how you feel about the different tests of change, especially when it's more of the feeling and the teamwork and communication, not operational.
Yeah, I hear you. It's hard to deal with failure. So having to position it for folks that if it fails, that's what we learn. That's our opportunity for learning, and it's going to tell us as much as success did, or even more. So
yeah, and what we say in Lean is celebrate the red, and that's difficult at first.
Absolutely, we are not trained to celebrate failure by any stretch of the imagination. So let me ask you: is there anything I didn't ask you that you want to tell our listeners? I'm going to give you the results of all of the work, what it's done for us from a bottom line, but from our metrics standpoint, from an accreditation standpoint, we reduced our nonconformances by over 55%. Wow.
From in the last couple of years, because we're always ready. And our internal audit program is picking up our high risk issues, and people are asking us, as I mentioned, when they feel there's vulnerability in their area, to come and look at it and what can we do to improve it, and is there something different that can be done. So that's is great. In our audit time, we used to have several different audits. So also as part of healthcare, you have to have environment of care audits. You have to have hand hygiene audits. You have to have, there's several different auditing that's required. So we've integrated our audit program so it's not all individual auditing, and we reduced our audit time, which is people, by over 70%.
Wow.
Yeah, it's big, it's big numbers. When you really look at it, it's big numbers.
That is a great story, and what a wonderful way to turn around something that looked like useless, burdensome bureaucracy and turned it into a way to really positively impact the entire healthcare system.
Mm-hmm. Exactly.
Well, thank you so much, Mary Beth. How can someone find you or communicate with you if they wanted to?
You can find me on LinkedIn, Mary Beth, MaryBeth, and the last name is Germyn at JERMYN.
Thank you so much. And you've been listening to the Just in Time Cafe podcast. My guest today has been Lean Cultural Transformation Leader Mary Beth Germyn of Exeter Health Resources. Thank you so much for sharing your experience and your wisdom today with our listeners, Mary Beth.
Thank you.
Don't forget to sign up for Elizabeth's webinar, by the way, on Wednesday, July 24th at 11 a.m. Pacific, How to Build Best Practices with Standard Work. Also be sure to enter our raffle for our free Greenbelt training and certification. To enter, you have to leave a review of the Just in Time Cafe podcast by July 31st. And you have to say that Elizabeth and I are the most brilliant on-air personalities in existence. I'm totally kidding, though.
No, wait a minute, we are.
Also, we now have a Greenbelt course that gets you CPE credits and another Greenbelt course you can combine with a project and coaching. So be sure to enter the free giveaway.
Tune in next month to hear my interview with Liz McCartney, author of Going Home, about applying Lean to disaster recovery efforts. It's an amazingly inspiring book, and I can't wait to talk to her.
That sounds really exciting. We can always use better efforts in disaster recovery.
Absolutely.
Thanks for joining us for another great hang at the Just in Time Cafe.
See you next month.